Hey guys, so today I'm going to be talking to you about ADH antagonist diuretics. So the way that ADH antagonist diuretics work are they are competitive antagonists and they work specifically in the G alpha S vasopressin V2 receptors in the medullary collecting duct. They work specifically on the V2 because as we know, we have vasopressin that works throughout our body. So V1 works on the blood vessels. V2 is specifically going to be in the kidneys, and V3 is going to be in the pituitary gland, and I'm sure we'll talk about that in the future. But yeah, so the ADH hormone is actually going to work specifically on the collecting duct, and I'm going to go over what ADH or antidiuretic hormone specifically does on the body, and then we'll talk about the antagonist diuretics, but that way we'll have a better understanding. So we have in the collecting duct these receptors, the V2 receptor, so I'll just draw it out over here. So this is the V2 receptor. And we're going to have this hormone, ADH hormone, antidiuretic hormone, and that's going to come over here and it's going to bind with the V2 receptor and it's going to activate it. And this hormone, pretty much, it's as the name implies, it makes us not urinate. It's an antidiuretic hormone and it works to keep homeostasis in our body pretty much when it senses that our body needs more water or our pressure may be low and we just need to hold on to more water. It's going to get activated. And once that does get activated, so I'm going to zoom over here. So this is pretty much a zoom in on what's happening on this section. So the collecting duct. So this is the lumen of the collecting duct. And we have in the collecting duct something that's called aquaporins. And when the V2 gets activated, pretty much that's going to activate the aquaporins to move from the side of the cell, and it's going to move to the apical surface over here. And what these aquaporins do, they actually increase the passage of water through the wall from the collecting tubule. That way it can get reabsorbed. The water is going to go through here and it's going to get reabsorbed. It's going to pass through the aquaporins and it's going to go through the bloodstream in order to get reabsorbed again. The main medication that we use as a ADH antagonist is going to be conivaptan, and it's a ADH antagonist diuretic. So it's pretty much going to come over here on this side, and the conivaptan is going to bind to the V2 and it's going to block the ADH from binding. And if we block the ADH from binding, then what's going to happen is that this whole process is not going to happen. And we're going to end up with the water not being reabsorbed into the bloodstream. And it's going to continue down and we're going to urinate that water out. So indications for conivaptan. So this is to treat hyponatremia because it's going to increase urine output. This is commonly used in patients who have SIADH, and to not get too much into it, but for SIADH, pretty much they have too much of the ADH hormone. So what they're doing is that their body's holding on to this excessive amount of water and their sodium's getting diluted. So if you give them conivaptan, it's going to block that ADH from getting activated and it's going to increase urine output, and that's going to normalize their sodium levels. A precaution or contraindication for this medication is going to be hypovolemic hyponatremia. So although we're going to give it for hyponatremic patients, we do want to make sure that they're not hypovolemic. So we're going to give it to someone who has normal fluid status or someone who is fluid overloaded, because it could have the adverse effect of a hypovolemia. So we don't want to further aggravate their situation if they're already on a low fluid status. Monitoring, so we're going to monitor their sodium levels, we're going to check their fluid status, and check their urine output. All right, thank you.